Hello class, welcome to Psychology 200. Again, we are studying Essentials of Psychology, Chapter 14, Methods of Therapy. Remember last week we talked about psychological disorders, so now we're going to talk about how we are to treat those disorders. So some methods of therapy or some therapy modalities are going to be found in this chapter. Pay close attention once again. And you may even be familiar with some of those. Because we see so much of mental illness and psychological disorders throughout our society, you may be familiar with someone who has a diagnosis or who's receiving treatment. You may even receive treatment for different things. So please pay attention, and hopefully you will be able to identify or learn some of these information. Chapter 14, Methods of Therapy. When people have behavioral or emotional difficulties, they may benefit from some form of therapy known as psychotherapy. In this chapter, we're going to identify, define, and review some of the therapeutic methods that are used to treat individuals who have a psychological disorder or a diagnosis. Types of psychotherapy. We can begin with a verbal form of therapy delivered from a psychological framework that consists of one or more treatment sessions with a therapist. These are pretty common. Your psychodynamic therapy is probably what we think of most often when we think of psychology or psychiatry. It was the original form of psychotherapy developed by Sigmund Freud, and you may hear it referred to as psychoanalysis, the psychodynamic approach. Psychoanalysts or are indeed psychodynamic therapists who practice the Freudian tradition of psychotherapy. The psychodynamic therapy, again, psychoanalysis may take on various forms or techniques to uncover the workings of the unconscious mind. If you think back when we studied Freud, we thought that his definition of abnormal behavior, again, dealt with the unconscious urges that we try to keep pushed down in our unconsciousness. But some of the techniques that they use are free association. This is where a client is encouraged to say anything that comes to their mind. Dream analysis, the interpretation of those dreams, resistance, and transference are things that you're going to see a lot from this perspective when you're working with clients. Like Freud, modern psychodynamic therapists believe the importance of self-insight. However, in contrast to Freud, they offer briefer forms of psychoanalysis or treatment. Freud's therapy would last generally anywhere from 3 to 7 years. So it was very intensive, very extensive as well. Let's see here. Let me go back and see where we were. Okay, I'm sorry, guys. Humanistic approach. Carl Rogers is one who comes to mind. Humanistic approach has a much brighter outlook on our human behavior. And Carl Rogers came up with what's called client-centered, person-centered therapy, in which the focus is on helping a person act in ways that are consistent with unified and genuine self-concept. Three of the components of his client-centered therapy is unconditional positive regard, empathy, and genuineness. You want the person to believe that you're genuinely concerned about their behavior and who they are. Gestalt therapy, developed by Fritz Perls, is more directive and sometimes even confrontational in therapy as opposed to Carl Rogers' client-centered. Read more about those in your text or on your PowerPoints and things of that sort. Behavior therapy utilizes the principles of learning to help people change their maladaptive behavior. One of the techniques that are used by behavior therapists is systematic desensitization. It is a form of exposure therapy that helps us overcome our fears by applying relaxation techniques, and gradually introducing that person to the object that they fear the most. The use of modern technology such as therapy apps and virtual reality has become a very huge part of what we do in psychotherapy at this point. Behavioral therapy is takes a gradual approach to helping people work through their fears. Here, an individual may have a phobia of riding the elevator, so they may go from looking at a picture of an elevator to actually getting onto an elevator. And it's a systematic approach in how they do that, and not just, oh, let's get on the elevator and see how you do. Another behavioral and cognitive approach are often combined, where your thought processes are in there as well as what you do. They employ techniques to help people develop more adaptive behaviors and more adaptive thinking patterns, because if you think about it, many times what you think is what you do. You can think yourself into a frenzy, or you can think yourself into doing something that you thought you never could do. So here's our cognitive approach. And the person that we are going to attribute this theory to is Albert Ellis, Rational Emotive Behavior Therapy. He looks at an ABC approach, where you're activating event, such as receiving a poor grade, leads to a belief that I'm just a complete jerk, I'll never succeed. Now that's pretty over the top, because just because you get one grade doesn't mean that you're going to do poorly for the semester. But let's keep with his theory. A, the activating event, B, the belief, and C, the consequences. Because of this one bad grade, because you believe you're a complete jerk and you'll never succeed, then the consequences are feeling unworthlessness and depression. And so that's how he defines it. So he's going to look at your thought processes and how they interfere or how they contribute to how you act. Aaron Beck is another cognitive therapist, and he wants to help people understand how their erroneous or false thought processes influence the perception of the world and their reactions to certain life events. This is a good one to read, and most of you could probably identify that. I'm sure you have had many times where you thought the absolute worst, you believed the absolute worst, and then you acted on the absolute worst. But this is an eclectic approach, eclectic. Now, many psychologists and therapies, even though they may be trained in one school of thought, are learning to pull from various therapeutic approaches in an attempt to assist their claimant or their client with meeting their needs and overcoming their issues. You have group, family, and couple therapy. Again, you've seen or you've heard of those. Please read in detail more about them. Is psychotherapy effective? As always, and I've said in class so often, there is still ongoing debate about that, and the verdict is still out. There is benefits to all. It seems that there is no single answer to that, and no single therapy which may be superior or above any others. But again, they're worth a shot. Looking at multicultural issues in treatment, again, just like cultural differences in how we accept normality and abnormality, the same thing when it comes to providing treatment. Some people would prefer to receive treatment from therapists who look like them or who have their similar backgrounds. Here's an overview, as we see in all of our chapters, of the major types of psychotherapy, the focus, length of time, the role of the therapist, and the techniques that they use. That's going to be very insightful for you, so pay close attention to those as well. There are biomedical treatments, as you are well aware. Drugs that are used to treat psychological disorders are classified within several major categories. You have your anti-anxiety drugs, antidepressive drugs, and of course antipsychotic drugs. And while psychotropic drugs may be effective, they are not a cure and can risk serious side effects. Oftentimes what you will see is the pharmacological treatment as well as a behavioral treatment going hand in hand to assist the client with getting control of their disorder. ECT, or electroconvulsive therapy, is widely misunderstood. It involves administering a jolt of electricity to the brain while that person is under anesthesia. It is not a first-line defense. Usually you see this only after multiple trials with other agents have been used and have proven to be unsuccessful. Again, we have to weigh the risk against the benefits, as it is with psychosurgery. You don't see these nearly as much as you have in the past, but again, they are available and they are used as a last result. The movement toward community-based care during the past 50 years or so, early 60s or 70s, we led to a shift away from inpatient treatment to deinstitutionalization, where people with psychological disorders or mental disorders were moved back into their community so that they could be closer to family, they could still receive their treatment. This was a very gracious attempt, but also led to other societal issues. Again, here is your chart overview with the class of the drug, the names, brand names, clinical uses, and possible side effects of each of those drugs. And again, I've just given you a list of those for treatment. That concludes our chapter. I hope that you have enjoyed the lecture and it's given you some insight. So have a great day. Thank you.